Who's ready for the final stretch here for the jukeboxes? Huh? Separating us from the, from the coffee break. At least Z is, right? Well, we're going to talk about lowering disease pressure in growth finish. And why are we talking about that? Well, I always like to start with the why, right? And well, two reasons. Obviously, PRRS will cause a slower growth performance for those finishing pigs. It's going to kill those pigs. It's going to increase antibiotics. It's going to be all bad for those finishing pigs, right? But also, if we look at the grand scheme of things in the ecology of PRRS virus, specifically, the growth finish population is also not only a hot spot for virus emergence, but also virus amplification into the region. If we look at where the viruses emerge, the new variants, where they come from, most of those, they first emerge in growth finishing pigs. Because again, that's where you have commingled sources, you have shared equipment, you have shared people, you have lots of epiconnections. So that's where our bad viruses emerge and then finds the way back to the sow herd. And so when we talk about lowering disease pressure in growth finished pigs, you gotta remember that the growth finished pigs are our end product, right? It's the final product from the whole herd. And gotta remember that even though we're gonna talk about what we do here, we are never gonna achieve optimum results if we don't fix all the way back from the gilts, right? That's where it starts. The finishing pigs, pig health, is only going to be as good as your gilt health is. If you have sick gilts, what's going to happen? You get sick gilts are going to move to the breeding herd. You're going to have unstable, sick breeding herd. What can you expect from your growth finishing pigs? Your vaccination alone, you saw the results. It's going to decrease the clinical consequences of infection, yes, but it's not going to be the silver bullet that's going to fix it all. So as we discussed this morning, it's all a package deal where you expect that the vaccine is going to help you decreasing that pressure of infection, but you got to take care of gilt acclimation, of gilt performance, meet your breeding targets and everything, and bring your breeding herd back to stable and control. Then you can discuss what you're going to do with your finishing pigs. And we discussed that couple perspectives ago, Marius. It's the back to the future concept, right? You go back to your gilts, you fix your gilts, you acclimate them well, you make sure, Nikolai talked about that you gotta come to the breeding herd, immunize, non-shedding, and then when you do that, your future breeding herd is gonna produce as well as you expected them to produce, right? It's going to reach the genetic potential, and then your future finishing pigs are going to do well as well. So what do we expect from the PRRS MLV? It's going to do those two things that we talked about. Reduce shedding of the wild type. So it is a biocontainment tool for the region and for the surrounding breeding herds, the surrounding finishing sites, the surrounding nursery sites and everything. And it's going to do well for the vaccinated sites as well, right? Because it's going to reduce that ability of the wild type infection to thrive, to infect the macrophages, and to prevent all the lesions that Marcelo described that it will happen under the microscope. And so when we talk about vaccination, how about timing of vaccination for the growth finished pigs, timing and a number of doses, right? Those are two frequently asked questions. Am I going to vaccinate? Yes, but how and when? And so this is a simplified, what we call, Marius, the decision tree, right? This is the simplified version. At least we start a discussion. If you are, up there, you have the status of the breeding herd from which those growing pigs are coming from. And if they're acutely infected, we briefly talked about that this morning. If it's right after the outbreak, you don't want to vaccinate really sick pigs. If the baby piglets are dying at the beginning of outbreak, you heard from Clayton, there will be several weeks, depending on the lineage, where mortality is going to be near 100%. So you don't need to vaccinate those piglets. But as soon as the herd starts to recover clinically, then it's a good idea to start vaccinating them as early as during process time, right? That 2, 3, 4, 5 days of age. And then you temporarily vaccinate that with attempt to reduce that pressure of infection. And so the vaccine gets to the pigs before the wild type does. And then once those pigs start being weaned healthy again, then you can probably push that vaccination back to the weaning time, and then reduce that to a single dose may be all you need. And then you keep observing. Like Clayton said earlier, you gotta be observing. It's not a magic thing. It's really a clinical assessment, diagnostic assessment. When the early nursery pigs are doing fine, and then that disease, the vaccination and the immunity is holding clinical signs until at the end of the nursery, then you could push that vaccination back to weaning time. And then hopefully the herd is also, you are working not only with the finishing pigs, but you are working with the breeding herd, so you're bringing that back to stable. Then you're going to vaccinate them at around weaning time. One dose may be enough if or when you only have one wild type circulating, or perhaps if those pigs are going to a low dense area. But in a lot of times, depending on the regions, right? We work in Iowa. Iowa is a super high dense area, so there are some herds that are really surrounded by other herds. In that situation of high pressure, we've done experimental and observational epidemiological studies with producers, and we're confident enough to say that in those situations, a second dose of vaccination is going to help to bring that pressure of infection further down and prevent that clinical consequence of infection, right? And then as you move to negative, and if you move to negative, if that's your goal, if you're Nikolai-like scenario where you're really isolated and can keep those herds negative, then may want to vaccinate them just once if they go to high pressure regions, or don't vaccinate them at all if they are really negative, and then raise in low dense areas where they are pressure of infection, their chances of getting infected are low. Okay? And so once you vaccinate, you just don't vaccinate and forget about it, right? You gotta trust your program, but you gotta verify. And then how do you verify that? We talked about sampling, diagnostic monitoring the breeding herd in the morning, and it's the same concept for grow finish pigs. With the difference is the sample type. For grow finish, it's hard to beat the practicality of oral fluids. So for monitoring those pigs for PRRS activity, all it takes is about 6 oral fluids, 5 to 6 oral fluids. You pull them to 1 or 2 PCRs, and that's enough to monitor for PRRS activity. You do sequencing if you like to understand number of viruses that are infecting those piglets and the pressure of infection. We talked about clamp sequencing earlier to differentiate wild type and vaccine. And there are some other tools. So in closing remarks, reducing PRRS pressure in the grow finished pigs, yeah, there's something you can do about that, right? We discussed here timing dosing of vaccination, but for the finishing pigs to really achieve the maximum genetic potential, you gotta start with the gilts. You gotta start with the gilts, then transition to the breeding herd so that those future finishing pigs are healthier. PRRS almost never comes alone. You saw data here from Marcelo, from the lab, right? Mycoplasma, Salmonella, PCV, Streptosuis are other frequently flyers here with PRRS. And the final protocol that's going to be ready for your farm is going to depend on the 5-step process. And again, as you saw, the solutions may change depending on your goal, depending on your region, depending on your pressure of infection. But the good news is the questions are the same. It's all following this 5-step process, and that's going to simplify your decision making on how how to control and achieve the results your farm needs. With that, Oliver, it's time for your steps.